Hello, this is Eddie Barragon, and I'm here today to discuss to you the physiological process of plasma clearance. Yes, thank you for giving me an opportunity to discuss and explain the purpose of plasma clearance and the importance that it has on the human body. Thank you. Let's get started. So, a bit of a brief introduction. Plasma clearance is the physiological process of a imaginary amount of plasma being infiltrated or saturated with a certain chemical or substance, typically an administered drug, a controlled substance that is supposed to have a specific effect on the body. A good example would be during anesthetization, um, to prep for surgery, or even prescription medication to deal with pain. Basically, when that substance travels through the circulatory system and infiltrates units of plasma, there has to be an estimated sort of clearance for that drug, whereas how much of that drug can exist safely within the body's plasma and be reasonably diluted over time so that the effect is controlled and only lasts for a measurable amount of time within the body. Um, yeah, it's basically very critical when it comes to the understanding of how drugs are taken and processed through the human body. Um, it's the main way that doctors are able to administer drugs to patients in a safe and reliable manner. It's basically the principle of what allows a controlled substance to be given to a patient, and with the expectation that that's going to be filtered out by the organ of filtration or excretion, usually renally. In this case, what that means is the kidneys, but also, of course, that translates to the urinary tract system as well, and how the body is able to expel that substance after having the desired effects, or in some cases, which I'll go into in detail a little bit later, undesirable effects, right, when it comes to illegal substances. So yeah, plasma clearance, it's critical to the understanding of how drugs are taken in and processed by the body. Some of the major anatomical features um, are, the afferent arterial and the efferent arterial, basically intake, outtake. Urinary excretion, like I mentioned, that is the excretion and filtration aspect of it. The vertebral capillaries and the renal vein being, again, kidney function, as in the actual real filtration of the substance. And it happens in four major sequences. First, we have filtration, then we have reabsorption, then we have secretion, and then excretion, in that order. So, yeah, that is basically the basis physiologically for how plasma clearance works within the body. I'll get into a little bit more detail about a few other functions in just a sec. Essentially, the purpose of plasma clearance is to be able to measure the rate of a unit of plasma in its filtration process and the removal of the toxin or substance within the body. This is very, very, very critical in a medical or scientific field, but basically it has to be done very precisely, and the way it's done is by using a formula that measures the plasma that is cleared of the substance per unit within a certain amount of time. That formula is known as the renal plasma clearance formula. So it is the volume of plasma cleared, again, per unit time. And the formula goes as follows, and that is CS equals US times V over PS. And I'll explain those and break that down into a little bit more detail. So CS referring to clearance of a substance. That is the overall function. That is the overall value, right? So that is the end goal, is the clearance of the substance. And this is what it equates to. Now, that may seem obvious, but in reality, to get a good breakdown of clearance, every single factor has to be carefully considered in the equated formula. So when we go to US, and that is the urine concentration of a substance, to what degree is that able to saturate the body's excretory function and impact again, the saturation point of our urine? That has to be measured, both the critical maximum absorption point and then everything leading up to that, and then everything following that. The process to which we need our urine to be less saturated with the substance over time in order to maintain a safe level of the drug having been administered, right? Otherwise, that can cause further issues down the line. And this is times V, which is volume of urine in milliliters over certain amounts of minutes. That is, again, as I explained before, as I broke down before, unit of measurement divided by units of time. Volume of a substance over a certain period of time. That's really the main key takeaway. And all of it is being divided by the main substance or the main bodily process that takes precedence here, and that is the plasma concentration of the substance. So in essence, we're looking at urine concentration. What is the volume of the unit? What is the duration of time for that volume in comparison? And nothing exists without comparison, right? So of plasma being concentrated of that substance, and that process being excreted directly from the plasma or expelled from the plasma in a controlled, measurable unit of space and time. And then it all goes back to the main function, CS, clearance of a substance. That is the main process that we are discussing. That is the overall end goal. Clearance of a substance. That's your final result. That is your mathematical answer. That is the quotient that we are trying to get back to. So this is how doctors and medical professionals evaluate, estimate, and calculate everything that they give to a patient, or everything that a patient has given themselves. And that's something that I want to go into detail, and that is the estimated amount of time for, let's say, an overdose, right? That's a good example that is happening, whether that is a drug overdose on barbiturates or THC level drugs, which, yes, are harmful, and that's a separate issue. But anyways, or if it's alcohol poisoning, again, that's very comparable to what we're discussing here. Your blood content alcohol level is very comparable to what we're seeing and examining here. So again, yeah, this is a very useful formula. It's life-saving. It's something that a lot of people don't really take into account or consideration. And I've seen this myself personally when I've met people who, I for all intents and purposes, could not be reasoned with when I told them that, you cannot take 10 Tylenol at the same time just because you feel in your, arbitrary subjective experience that it feels 10 times worse or more painful. There is a way to estimate this, and often, the instructions that we read on the back of a panel of a drug product are very clear with that as well. We cannot deviate from the measurement. We cannot deviate from the calculations. If we do, we are taking our life into our own hands. And that all comes back to the principle of plasma clearance. That's why this is such an important topic, and why I wanted to discuss it in such detail. So yeah, that's basically all I really wanted to discuss and go over when it came to plasma clearance. It is a subject that I find personally fascinating, that I have personal experience with, that I have a very good understanding of, and something that I've been wanting to explain the application of for quite some time. It is a relatively straightforward process. It's very easy to calculate, but that doesn't understate its complexity or importance. Knowing it well is what allows doctors to be able to anesthetize and treat patients effectively and safely. It's what allows us to intervene with life-saving medication or processes or procedures within a certain situation. Let's say, again, of an overdose or an adverse reaction to a certain drug. There's millions of factors to consider with everything, right? With the human body, we are relatively complex beings. On a physiological level, nothing theoretical about that whatsoever, just strictly factually in terms of the chemical reaction and reactions happening in our bodies. That alone is worth considering. But yeah, I mean, that's everything, and I hope you found this useful and insightful and somewhat educational. Thank you for listening to my discussion on this. I worked really hard on it, and I did quite a bit of research and a lot of anecdotal searching for it as well. So thank you. This has been Eddie Barragon, and yeah, thank you for your time.